The COVID-19 public inquiry. What do we know about what has happened so far? Does the inquiry represent a real chance at exposing the harms of the pandemic response? The inquiry commenced last month, and the first two preliminary hearings have now been heard. I've recorded two in-depth episodes on the inquiry so far. So tonight's 10-minute broadcast is here for you to get an understanding of what's happened in short. So, firstly, the UK COVID-19 public inquiry was established to examine, consider, and report on the UK's preparations for and the response to the COVID-19 pandemic. And the first preliminary hearing was heard on the 4th of October. Baroness Hallett, who is leading the inquiry, said the inquiry would likely analyse the state of our readiness for the pandemic and the response to it, and determine whether the level of loss was inevitable or whether things could have been done better. Already an early indication for the focus of the inquiry. Now, the terms of reference set out the scope of the inquiry, including the broad themes that will be covered. Now, these themes and topics were amended and broadened following the public consultation earlier this year, where there were over 20,000 responses received. And those changes were positively met and have massively increased the scope in which we'll cover an enormous amount of areas now over the course of a series of modules. So the inquiry is an independent, allegedly fact-finding exercise, and the terms of reference get broken down into modules which will look at each distinct part of the pandemic response in a sequential way. And I'll break down these core modules shortly. But first, we must analyze what stage the inquiry is at now. You heard me say that the preliminary hearings have now been heard. So let's make the distinction between a preliminary hearing and a public hearing. So firstly, a preliminary hearing is a set of procedural hearings where the decisions about the nature and procedures for the public hearings will be made. So it's really administrative. It's really setting beyond the terms of reference. It's about establishing how the inquiry will proceed, how evidence will be collected, how it will be processed, how it will be disclosed, and what will and what will not be included within the context of each module. So no evidence has yet been presented. So the hearings that have taken place so far are about the evidence that will follow. It's at the public hearings where the inquiry will formally hear evidence from a range of participants, including witnesses under oath, and these public hearings will commence next year in 2023. So let's run through the modules that we've heard the preliminary hearings for so far and get a sense of what's likely to be covered. So the first module, which was heard at preliminary stage on the 4th of October, will cover the extent to which the United Kingdom was prepared for a viral pandemic. To what extent had the government planned for such an eventuality? How well prepared was it? It will also scrutinize some of the decision-making relating to the planning and the organization of the government from the national level to the regional to the local, and also look at how lessons were learned from prior incidents such as epidemics relating to influenza and past simulations. Module 2, which was heard on the 31st of October, is what we covered earlier this week on our previous episode. This will examine the UK's core administrative and political decision-making and will cover the initial UK response to the COVID-19 pandemic, including the whole manner of non-pharmaceutical interventions. In other words, lockdown, social distancing, masks, and all the different restriction requirements that were unfolded, as well as the use of scientific expertise, data collection, modeling, government and health communications, public health communications, i.e. propaganda, the mass behavioral science that was used behind the messaging, and the maintenance of confidence and parliamentary oversight. If I'd had thought about it, I could have gone parliamentary oversight on the basis that there was none, and regulatory control. I'm deviating slightly. Stay to the script. This is a short overview of the COVID-19 public inquiry to date. Module 3 has now been announced and will examine the impact of COVID and of the government and the societal responses to it upon the healthcare systems generally and on patients, hospitals, healthcare workers and staff. It will look at the impact of COVID-19 on and the response to it in terms of the NHS backlogs, the non-COVID treatments, and the effects of healthcare provision during this time. There are 12 points that module will go through, and we're going to do a full episode on module 3 in the coming weeks. What else is likely to come up? Well, it's only these 3 modules that have been announced so far, but very broadly, what's likely to be included in future modules are vaccines, therapeutics, and antiviral treatments across the UK, the care sector, the government procurement and PPE, i.e. those crony contracts. Again, state of the script, Dan. Tonight's just about an overview. I'm not going to get into the detail because we'll be here all night. Testing and tracing, government, business and financial responses across the UK, and impact across the business sector, including hospitality, retail, tourism, arts, culture, sport. Also the impact on public services and public sectors, impact on education, children and young people, impact on self-employed. Now, the question we might be asking ourselves is who gets to provide evidence, and that's an important question. Well, within each module, a number of core participants will be assigned. Now, unless there's an application process, any organization or collection of organizations can apply, but who will be selected is down to the legal team and Baroness Hallett herself. And so far, those included represent bereaved relatives, government departments, the Health Secretary, the UK Health Security Agency, the NHS, alongside other public health officials and ministers within the devolved nations. But it's been subsequently expanded to include those representing minority and vulnerable groups. But the clear omission is any critical group that is like the Heart Group, for instance, or any of the campaigning groups that have worked hard, like Save Our Rights Together, etc. The Pandemic Podcast, I'll include. There's a distinct absence of critical voices, and it's very much officialdom that's included so far. It's the government and the healthcare agencies. So I think, if we're looking at the analysis part, the core participants are very limited. However, members of public and other groups and organizations not awarded core participant status will have the opportunity to submit evidence, and there will be more informal listening events around the country, which people will have the opportunity to attend, though it's not yet clear who exactly will have the opportunity to attend those events. It's obvious so far from the evidence that bereaved families will have the opportunity to contribute, but the wording around who will participate is so loose at this stage, described as those who suffered hardship or loss as a result of the pandemic. Now, in my view, in my opinion, every one of us has suffered as a result of the pandemic and the response to it. Our lives have been radically altered. We've seen unprecedented interventions to our freedoms and our rights at scale, and we have seen and witnessed the harms of the response and the policy decisions as a result of the interventions to COVID-19, far outstripping in the short and long term the impact of COVID itself. So you could argue that we've all been harmed, that we've all suffered. So therefore, we should all have the opportunity, if we choose, to have our voices heard. Side note, the Pandemic Podcast is back for the purposes of this work, and we will be running alongside the inquiry, and we hope to give you the opportunity to have your voice heard, even if the official inquiry does not offer that opportunity to you. Now, this listening exercise, as I mentioned, will begin later in the year. It will gather the experiences from across the UK. Who will be included, as I've mentioned, is not clear yet. But again, in light of what I've mentioned around the core participants, there's a real focus on voices that are not always heard from minority groups and vulnerable groups, which is important. But it's not yet clear exactly how this information is going to be collated and distilled, because you can imagine just how many people may want to have their voices raised. So the details on that are yet to be disclosed. Now, in addition to this, expert groups will be given the task of creating reports which can be used in evidence, setting out where they agree and what they disagree, and analyzing the evidence. And for each module, there'll be a number of expert witnesses called upon in addition to core participants. And again, so far, it's a little vague about how those will be assigned, selected, and allocated. So watch this space and more on that. But what is clear is that the inquiry chair, Baroness Hallett, has a lot of power in this inquiry. She gets to decide how much weight to give to any matter within the inquiry, but specifically in the context of this point, how much weight that she will allocate to the expert witness reports. Now, for those of you like myself looking at whether this inquiry offers the real possibility of delivering some sense of accountability, unfortunately, it's unlikely to do so. The role of the inquiry is simply to establish the facts and ascertain what went wrong, what went well, and to make recommendations to the UK on what it must learn from this pandemic and for its future planning and response to civil emergencies like this one. The inquiry has no powers, to be clear, the inquiry has no power to prosecute or have proceedings brought against anyone, let alone fine or imprison people as a result of their actions or omissions in respect to the pandemic. So this particular exercise will not lead to any form of justice. And this applies whatever side of the coin you approach this on, from whether you're looking at it for someone who's lost a family member or whether you're looking at someone who sees the injustice in the way that the response was unfolded with lockdowns and all these other interventions in our livelihoods. So this is a rapid fire overview of what we know so far about the public inquiry. As I said, I've already recorded 2 full episodes on this, 40-minute episodes, breaking down each of these points in more detail, giving my opinions and perspectives on some of these parts. So if you're interested to find out more, you can check out those episodes. They're available on YouTube. They're also available within the Elevate Network, our private platform, and you can find them on our audio podcast, Elevate with Dan Astin-Gregory, on every major audio platform. If you haven't checked out the audio podcast yet, please go look us up on Spotify, Apple, whatever you use. Just search for Elevate with Dan Astin-Gregory. Now, the final thing I'm going to say on this, if you're interested in finding out more and exploring this topic further, over the last couple of years, we've reached 10 to 15 million people with our content on the Pandemic podcast. And I know there's a great deal of you out there that have been really vested in the storylines that we've witnessed over the last couple of years and how we can challenge some of those key decisions that were made. Well, if that's you, then good news. We have an online panel event coming up tomorrow night where we'll be taking a more in-depth analysis of whether the public inquiry offers any real potential to unearth the key events that we know have unfolded before us. Even if accountability and justice will not be served, will it offer the opportunity to reveal the flaws in the policies and the protocols and the decision making and the modeling and everything else that followed? Will it really offer that opportunity? So we'll also be exploring what we can do in parallel to the public inquiry. This event is happening tomorrow night, Wednesday, the 16th of November. We'll be joined by Barrister Francis Hoare, Professor David Patton, Professor Paul Reuters, Dr. Claire Craig, Dr. Liz Evans. We've got a fantastic panel where we'll be discussing some of these key components in depth. So we invite you to join us tomorrow evening. You can join us over at weareelevate.org/public inquiry. Come and join us to take part in the discussion, ask your questions, join the conversation. It's likely to be a 90-minute to 2-hour event online. You can join us from the comfort of your home. So to join us, go to weareelevate.org/public inquiry. Thanks for tuning in to this special short episode, short for me at least, just under the 14-minute mark on the public inquiry and the progress so far, what we know in short. Look out for our event tomorrow night, and I'll see you again later on the Elevate podcast.